Good evening. Welcome to this episode of our month-long e-campaign on breast cancer awareness brought to you by IHW Council and Novartis India. This is the second edition of the Breast Cancer Action Month, where we will be bringing together all stakeholders, be it policymakers, experts, oncologists, social workers, influencers, and cancer warriors who have successfully overcome breast cancer on this very platform to create awareness about breast cancer and motivate everyone to take proactive action to reduce its risk. We believe that even if one life is saved because people are talking about breast cancer, the Breast Cancer Action Month is a success because this killer has devastated families, wrecked dreams, and is causing immense strain on the healthcare system at a time when we are fighting a pandemic. Now, October is observed world over as Breast Cancer Awareness Month, and we dedicate our efforts to the brave ladies and men who are fighting this disease. Let's do a quick recap of all the ground that we covered in our campaign last year.
Breast cancer is the number one type of cancer in women today.
मुझे आज ब्रेस्ट कैंसर एक्शन डे से उम्मीद है कि जागरूकता और उपायों के बारे में लोगों को बताकर हम देश में ज़्यादा लोगों के बीच कैंसर होने से रोक सकते हैं. I'm confident that the contribution of the Integrated Health and Wellbeing Council will certainly help in checking and treating cancer.
That this is preventable provided we feel ourselves on a daily basis. We love our bodies, we value them and take care of them.
Awareness around cancer, awareness around women health, awareness about around all the artificial things that we engage in, and vanity has its own impact on our health. And I think it's time to turn the tables on the other side.
In order to defeat breast cancer, it really takes a village. In other words, it's take a holistic approach, not a silo approach.
The problem is really at two levels. One is, like I said, with the media centering a lot of communication around what is significant in that month. And the second is, as a society itself, we just don't want to mention the word breast.
We have to create a complete ecosystem which can really help early detection, early treatment, and help patients live a longer and healthier life.
Make sure that you put the patient at the absolute center of any solution that you design.
We have to educate them to do their self-examination first and to encourage the women to go for tests, which is very, very important.
I see role for each and every one to come together and, make this Indian healthcare system a very robust one.
Nothing stronger, this applies to than cancer prevention as well as early detection.
Every 4 minutes, one woman is diagnosed with breast cancer in India. Every 8 minutes, one woman dies of breast cancer in India. More than 87,000 women perished because of breast cancer in 2018, and this was the second highest in the world for that year. Now, post-cancer survival for women with breast cancer in our country averages around 60%. But if you compare it to the US, that is around 80%. It is believed that 50% of Indian women suffer from stage 3 or stage 4 of breast cancer. These are the women who are diagnosed with breast cancer, and nearly half of them come in advanced stage. So we started speaking to experts, to survivors, to social workers to find out what can be done to change this, what can we do to make women more aware of taking care of themselves because cancer is not going to stop. So here are some highlights of what our experts discussed on the first show of this year's Breast Cancer Action Month.
Welcome to the inaugural session of the second Breast Cancer Action Month, a mega month-long movement to strengthen awareness about breast cancer and encourage action against this fast-growing public health menace.
Now we are getting breast cancer at a younger age. So it is when you educate these girls, they can also go home and, educate their mothers. So this is also one channel which you can use. Second important thing is screening, because as for any other cancer, and so it is true for breast cancer, the mantra is early detection, and early detection.
We need to improve primary health care. We have to make more affordable hospitals, affordable medicines. We must devote more money towards more budget towards healthcare.
The bottom line is the lady should be made breast aware. Then the next step comes consultation as to whom should she approach for treatment. And then third comes the treatment. We have the modalities for treatment. So availability of resources is not a problem at all. The correct utilization of these resources remains a challenge.
To pick them up and to take them to the right place for the treatment and hold their hand in the whole journey of treatment, that is what is required to be done.
A lady takes out 5 minutes of her time from her busy schedule, maybe once in a month, and devote that time for herself and really do the breast examination so that, she can able to detect the changes in her body and be able to reach out. Somewhere, I suppose, there is a lot of awareness which is being created, and if we continue on this journey, I suppose many of the ladies will be able to take treatment and may overcome this challenge.
When you talk about advanced cancer, it's a metastatic disease. What we are doing is completely palliation. Okay, and India is a huge country with so many people, where we have to give the treatment to each and everybody. Basic treatment should be provided. So what the government is doing, central and state government, we should not criticize. They are doing a pretty good job. Basic cancer treatment is being covered all over India.
Now, when breast cancer spreads from the breast or the armpit to other areas of the body, it's called advanced breast cancer. It's also called metastatic secondary or stage 4 breast cancer. Now, metastatic breast cancer may not be currently curable, yet there are many treatments available. And the aim of this treatment is to prolong life and preserve the quality of life by relieving the symptoms. Today, we are going to be joined by a panel of experts who will discuss the differences in the treatment of advanced breast cancer, its management, and its outcomes. So please welcome our esteemed speakers who are joining us on the show today. We have Professor Dr. Somashekhar SP, Chairman and HOD, Surgical Oncology, MHEPL, and Consultant Surgical and Gyno Onco and Robotic Surgeon, HIPEC Super Speciality Manipal Comprehensive Cancer Center in Bengaluru. Please welcome Dr. Srikant Tiwari, Consultant Medical Oncology, Jawaharlal Nehru Cancer Hospital and Research Center. We also have with us Dr. Hema Divakar, CEO and Chairman Artist for her, FOGSI Ambassador to FIGO, and Technical Advisor to the Ministry of Health and Family Welfare. We have Ms. Rubina Khan, Franchise Head, Breast Cancer, Novartis. She's a caregiver as well. We have Ms. Neha Anand, Senior Assistant Director of FIGO, and she's a breast cancer warrior. and Ms. Nisha Shah, a caregiver. A warm welcome to all of you, and thank you so much for joining us on the show today. A small request to all our speakers to keep themselves on mute and unmute themselves once we come to you. So let me start with you, Dr. Somashekhar. What is the most common reason for women to present themselves in a later stage of the disease, say stage 3 or stage 4? Because a mass in your breast is nearly always palpable. You can feel it. So how does this escape the attention of women? How come they present themselves too late in the stage of the disease?
Unfortunately, most of the people relate cancer to suffering and pain because they think that this is the most dreaded disease. Obviously, they think that there is going to be pain, suffering. So when a woman notices a lump, she knows her body best. She knows there is something not right, but because it is painless, they ignore it. So number one, early cancer of the breast, stage 1, 2, 3, there is no pain, no symptom other than a painless lump. That's number one. Number two, this is what we notice in urban population. What I've noticed in semi-urban rural is they are scared that, okay, if I am identified with this, I may lose my breast. The myths, lack of awareness is the second issue. So, when you couple both of them, that it is painless to start with, no signs and symptomless. Second, the fear of cancer per se, because they think that the treatment of cancer may result in loss of a breast, psychosocial and presentation, a lot of family issues. So lack of awareness, lack of screening, and then unfortunately suffering, relating it to be suffering and being painless. These are some of the factors in India. They ignore it until it's very advanced. Another issue is by the time a lump is palpable, it is never usually in first stage because we need to identify them by screening, which is an annual screening by clinical examination, memo ultrasound, which in India nobody does that. Even for a disease like cervical cancer, such a robust screening is there. Women don't undergo, and breast, we don't have a national cancer control program or a breast screening in India at all. So the moment they identify a lump, it's already second stage. So you can see how we have missed the steps. We don't do screening. We have no awareness. Woman doesn't know fifth day after her period, she has to do a breast examination. Then thinking that it is asymptomatic, painless, so I'll ignore. And the fear in other places where they think that, okay, if I identify, what if it turns out something and I may lose my breast? So let me just be in home until it becomes painful or it spreads outside and causes symptoms. That is when they start coming, which is unfortunate.
It's actually very unfortunate that you can feel something, you know something is amiss, but your fear drives you from not taking any action. So that's really a very bad thing and very unfortunate. Now, Neha is also with us, and Neha is a cancer warrior. Neha, could you tell us how did you come to know that you have breast cancer? Did you feel it yourself? And what stage were you diagnosed with?
Hello, good evening, everyone. I would agree. I would agree with you. I mean, all of the symptoms. I mean, all of the factors that you've stated just now. The three factors, they are right. My lump was painless, so I ignored it. After pregnancy, there were multiple lumps in my body, and I just thought that being a lactating mother, they would just go away with time. And I knew that something was wrong, but I still did not, got myself diagnosed or checked up. And because everyone says the cancer lumps are painful, but mine was painless. Yes, it was very small. I just thought that it would just go away with time. So I could have been diagnosed with at stage 0 or stage 1. However, due to the negligence and also due to fear, due to COVID, there were multiple reasons, and I was finally diagnosed at stage 2B.
Okay.
And
stage 2B.
Trust me, there was not even a single symptom of cancer, no pain, no blood coming out from the nipples, nothing. It was just the biopsy report that stated that, yes, it was a cancer.
Okay. How old? I hope you don't mind me asking. Neha, how old are you?
I am 33, and when I was diagnosed, I was 32.
32, and you said you were a lactating mother. Dr.
Yeah.
Divakar, for women in their 30s, lactating is good news. breastfeeding is a way to reduce your risk of cancers related to women's bodies. Neha would have been meeting her doctor as well, right? Um, if she has a lump which is stainless, shouldn't she discuss this with her doctor? I don't know for what reason she initially ignored it. New mothers are always so busy with babies, changing the diapers, no sleep, a thousand things. But how do we get women to put themselves first? She was a lactating mother and she would have met her gynecologist on numerous occasions and still, it didn't get diagnosed as stage 1.
Namaskar. Thank you, Anisha. Neha wanted to say something. I think go ahead, Neha. After that, I'll respond. Yeah.
Thank you so much, doctor. I just wanted to say, Anisha, I did consulted with my gynecologist and a lot of doctors. However, every one of them told me that since you are a lactating mother, it would go away with time. Give it a year, give it 6 months, give it 10 months. No one thought that it could be a cancer. No one. I mean, yes, I visited
I'm even more shocked. I'm even more shocked now. Dr. Divakar, this is a layperson. This is a layperson, and she was told just relax, let it go.
No, that's why
because I am a layman and I would go by my doctor's advice, my gynecologist, and my surgeons. So I had a C-sec. So I had told her on the day of my delivery, even after in the every month follow-up sections, that there are lumps. So she just told me that probably it might be you're lactating. It might be galactocele, or it might be something else. But she never hinted towards cancer. I even took a 2 months antibiotic course for that lump to go away. So yeah, nothing.
I think Anisha, you've asked me this crucial question and this crucial response from Neha, and I really appreciate this forum because it brings forth the real situations. Because for me, it's a mixed bag. There are healthcare providers and specialists themselves, as Neha has just alluded to, who do not pay enough respect to the patient's intuitive kind of, plea that, no, there is something not okay with me. Doctor, please see this. And they just push it under the carpet. And the system here is far more simpler. They can directly reach the specialist, because I've had few of my patients from the West where there is a whole process by which time they reach the specialist, and they just, they say, no, we don't think it is, so we cannot prescribe any of the either sonography or mammography or nothing. We don't do it. Then one of the patients, same age as Neha's, she has waited for 8 months, and then finally she said, I will pay for it. It is my self-request, and then you do this test for me. That is one extreme where the women themselves are actually seeking help. But again, the supply side has to be strengthened. When we say in certain situations in medicine that you have to have a high index of suspicion or a high degree of suspicion, this is one of these. You just check it out, make sure, rule out, and that's the way ahead. That is point number 1. The second thing is, anybody who hears in their office, or the relatives or mom or somebody is having been just diagnosed with breast cancer, a sudden spurt of anxiety, even if there's nothing, they'll simply be coming to us time and again say, no, there is something, just look at it. Like that also patients harass, and it's okay if they're seeking help. It's our duty to reassure them, do what it takes to rule it out, call them again at whatever frequency they would choose. Because the accessibility to healthcare, on one hand, we say it is so poor, but there are a bunch of women who want to come, and then we should not discourage them. So that is one seg. The other segment which you said, again, Neha's example, lactating. That means there are, as I have told in this platform many times, 30 million pregnant women, and now the deliveries in the institutes have scaled up like anything. That means at least 29 million are delivering in the hospitals. So that is a key target for us, for every single healthcare providers, the nurse practitioner, the OB/GYN, anybody, because we are dealing at that point in time with lactation. So we are talking to them something about the breast tissue. So we must sensitize everybody that that is a key target population. Enough of our blaming the patients that they are not coming, but then when they come, you're not even plugging the gaps that which exist in our medical practice. So at that time, if you teach her the self-examination, and anytime she comes, just check with her whether she has done it. Okay, because once telling her and letting her go and expecting her to do the homework, when they find that, 1 or 2, 3 months they have done, okay, 1 whole year disciplined way they have done, then they say, oh, there is nothing, then they'll leave it for 5 years and then they will come back with, something that worries them and worries us. So you have to keep checking at every touch point. And sometimes the patients come with backache and some weight problem. Our examination should include a routine breast check, because when they're available to us, we must make sure that we do it. And then there are many in the younger generation who see the YouTubes and self-examination. There's a lot of material out there. We must encourage them to see that and not cause a panic, but we must raise the caution or the alarm. So with this mix of the demand and supply, if every woman comes and she is aware, she says, no, I have done the self-check and this is what I'm finding, then it should be taken in its own merit ahead to see what best can be done. As Dr. Somashekhar said, if 50% are diagnosed late, what were these 50% doing when there was an opportunity to get the check earlier? So it is still a complex mix where we say that we are missing the bus. We could do better. And now that we have gotten together, all stakeholders, we will do better. Because that's the hope that we have to move ahead with, because many voices raised and amplified. And we saw that, your Twitter and the social media targets, they amplify, like anything. Even with one small doubt, again, somebody goes to the doctor and then one extra case is caught at an early stage, then we have done well, is what I would think. Even every
that is true.
patient counts, every single life counts. Yeah.
This is why we're having this dialogue, so that we streamline the process, we reduce the gray areas as much as we can, and we have a conversation not just between patients and, say, gynecologists, but gynecologists and oncologists as well, so that I've heard that there's a lot of discussions happening, so that gynecologists are made aware of the cancer risk. And they are also proactive in helping the patients.
There is one small point, Anisha. Practice what you preach is also my advice to all my fellow healthcare providers, because I know today of so many OB-GYNs who have been diagnosed with breast cancer in advanced stages. That is the truth of the matter. They, of course, their quality of life would have been so much more better if they themselves would have, practiced what they preached. Yeah.
And Anisha, I just want to interject. What Hema and also Neha brought. I'm the president of current Association of Breast Surgeons of India, ABSI. That's the only breast surgeon form. You will be surprised that there are 2 types of education required. One to common public, patients and layman. What Neha says, even though she's not a layman, always a lady is very intelligent. Somebody who takes care of the kid and husband, believe me, they are more intelligent. There is another education which is required towards actually the healthcare workers. What we have advocated from Association of Breast Surgeons as a president is, there is something called a triple assessment. Even God or the most, see, I've been practicing breast cancer for so many decades. Even I don't have eyes or fingers to feel a lump and say, this is cancer, this is not a cancer. It is very important to understand. We advocate through ABSI and societies called as triple assessment. Any lady, whatever age, she says there is a lump, 3 things every health worker must do. Number 1, clinical examination. Number 2, an ultrasound if a lady is young lady as Neha, or a mammogram if they're above 40, and a guided core biopsy. Triple assessment, 99.5% will give 2 answers. It is not a cancer or it is a cancer. If it is not a cancer, imagine you can just let the lady know that you're fine, you have been analyzed. And if it is cancer, you can treat. This is number 1. Number 2, we also advocate through Association of Breast Surgeons that every lady during her, prenatal, postnatal goes to her gynecologist. She has 6 to 8 scans for a baby. Simple first trimester, last trimester, also do an ultrasound of the breast. The lady is in front of you. The sonologist is there. These 2 things would educate the healthcare workers to understand that there is no delay as it happened in Neha's stage. Like stage 2B means node positive. Node positive means you need chemo radiation. We dropped down the survival from 99% to roughly 85-91%. And imagine what all can happen. So education only not for common public, also for healthcare worker, triple assessment and ultrasound of the breast during at least twice in antenatal.
And Dr. Tiwari, what are the changes in the breast that that tell us that the cancer is now advanced and perhaps spread elsewhere?
Hi, good evening, everyone. And there is good conversation was going on, and the ball was going on between whether the fault is on the patient side or from the healthcare provider sides. Actually, the Dr. Somashekhar has already cleared, and Dr. Neha has also, that the education is needed for on the both side, and it's needed on multiple level. I mean, I am working in Bhopal, and every day I'm encountered with many patients who are from the rural backgrounds. There is no facility available for the basic amenities like mammogram, or even if FNEC has been done, there is no good pathology lab or good pathologist to assess the tissue sample. Many times surgeon do a small biopsy, or you can say simple excision of the breast lump, and then the tissue will be thrown away in the garbage. Okay, so many things we used to see in day-to-day practice. So the multiple level work is required to diagnose early, so that we can cure most of the patients of the breast cancer. As far as the advanced breast cancer is concerned, look, technically the advanced breast cancer can be of two types. One is the locally advanced breast cancer, which is still curable. That means the stage 3, what Dr. Neha has, Mrs. Neha has stage 2B. So stage 3A, 3B, and 3C are locally advanced breast cancer. And the second is the advanced breast cancer, that is stage 4, the technically incurable breast cancers. So in case of incurable breast cancers, the symptoms the patient will present according to the spread of the tumor. Like if the patient is having, apart from the breast lump, if the tumor is spread to the bone, the patient will complain of the pain at some particular bony sites, or multiple the bony sites. If the patient is having the spread in the liver, the patient may say that I am having pain in the abdomen, my appetite is decreasing, I am losing my weight. So such type of symptoms. Many times the patients present with the brain metastasis, and patients used to say that in early morning every day I am feeling headache and recurrent vomiting, and they are using the simple painkiller, they're taking simple painkillers and going on and going on. If patient is having metastasis in the lungs, then patient may complain of breathlessness and all these things. So symptoms will depend upon where the disease has been spread. Number one, if the disease is still locally advanced, it's not spread to the other organs, then the symptoms the patients will have, it may have the enlargement of breast. Apart from that, there is the pudgy orange, we say the orange pill like the skin over the breast may be there. Sometimes ulceration over the breast, or the nodule formation over the skin of the breast. These are the common symptoms of the locally advanced as well as the advanced breast cancer.
Okay. We also have a caregiver with us. Nisha is joining us now. Nisha, for patients to deal with a diagnosis of cancer is definitely not easy. And for caregiver, the challenge exists on how to keep the patient comfortable and motivated to keep pursuing the treatment. Tell us how was it like for you as a caregiver taking care of a cancer patient?
Hi, good evening. Thank you for having me today. Can you hear me? Hello?
Yes, Nisha, go ahead.
Yeah. See, of course, it is very difficult to see your close relative go through everything, but it also helps that if they have a very strong mindset to handle everything. They are the people undergoing everything. They are the ones who, have to take hundreds of injections, hundreds of tablets, have to undergo biopsies, have to undergo multiple scans, have to undergo IV drips, everything. So it does help that they have a very strong mindset to themselves. I have seen people, take for example my mother, she's been undergoing this for the past 11 years, and you tell her any test and she'll always be like, okay, let's get this done. It doesn't matter if this is going to help, let's go for it. So even I'll just share this today. She's at an advanced stage over here today, and we still got a biopsy done, and she's not in the best condition to get it done, but we asked her and she's like, yes, let's get it done if it helps somewhere at my treatment at this stage. So it does help that they have a very strong mindset. Simultaneously, you also need to be updated. You also need to give them the facts. Don't cover up stories. Don't tell them that this is nothing and this is not going to this is just a regular test, or this is something that we are just doing for this. You have to give them the facts, give them the practicalities of the situation. Yes, don't give them the extremes of what can go wrong or anything, but give them the truth. if you are transparent with them, they'll trust you more. And that is what I think helps get the process forward. Once they start trusting you that yes, this medication is going to help me in a certain way, these doctors, and you have to do your best. You cannot leave it somewhere and say that, okay, this medication is not working, or this one test is not working out, let's just leave it, nothing's going to work. No, you cannot leave it at that stage. You are in this, you have to make sure that it reaches till whatever end you have to do. You have to be there for them, and simultaneously you have to assure them that you are doing your best. They have to be strong enough to get through everything. And like I said, being transparent with them about the process, they'll trust you more, and they'll have this willpower to go ahead with it as well.
All right. So the caregiver is really very important. The caregiver is the support for the patient. Now, Rubina, I want to come to you. You know what Dr. Somashekhar said in the beginning, that they know something is wrong, and yet they have not taken adequate measures to seek help. Now, in our country, what happens is that when something like this happens, like Neha also, she was busy and she was told this will go away. Many people will try any type of medicine, all types of medicines, all kinds of medicines before they come to the right place. By the time it's very late. Now, what do you want to say about women coming in the later stage of disease? What is the right medicine? And I mean, should people be scared of expenses, or pata nahi kaisi dawai hogi, cancer nahi marega to dawai maar degi? These kind of things people say, cancer se nahi mare, par dawai se mar gaye. So we want to get this out. Take the right medicine. That is very important. Take it the right time. So what do you think? Do you think this could be a reason why women come? Some women who are not knowledgeable or who come late.
Thanks, Anisha. I think that's a really important point that you've brought forward. As I'd been hearing Neha's story and Nisha's point of view, I also connect with them really well, because I've also been in the situation where my mother has been a breast cancer survivor. Very similar situation to what Nisha has gone through. Now, if you ask me, I believe the women are actually really scared. The first thought that comes in is, it can't be me. Mere saath to ye ho hi nahi sakta hai. It can be anybody, but not me. And that primary fear holds them back from taking any step. That's when they'll go to anyone who they can. The way you also rightly put it, the women do not put themselves first. The family is first, the husband is first, everybody is first. If they have to blame someone, it can't be me. It can be someone who drinks, someone who smokes. It can be anything. It can be just because the gods are unhappy with you, which is why you got cancer. So it's your fault. It's not my fault. It can't happen to me. That's probably one of the reasons why the women don't come forward when they first feel there's something wrong with them. When they do, they don't really know which is the right doctor to go to. I mean, as a layman, if someone would ask me, I would also go to my family physician or to a healthcare practitioner who's close to my house, who knows my family history. So that comes to the point where Dr. Somashekhar said that gap also needs to be filled. Alternative therapies are always prevalent. A lot of people have belief in them. At that point, what I'd say is, first, it's important to have knowledge about the disease. It's important to have knowledge about your condition. It's important for us as professionals to detach cancer with a death sentence. We have to stop treating it as that. We have to treat the word cancer as just another medical condition that a person could get. It's becoming like that today with the second person having it. But we have to stop treating it as a death sentence. The women will stop feeling scared of that. Then they will say, okay, it's an illness I have. I need to get it treated. Now who's the right doctor? If you have a Gynec issue, you go to a gynecologist. You don't go to an orthopedician, or you don't just limit yourself to a family physician. That's the kind of knowledge that they need to have. Once they reach the right doctor, I think that's a journey that still needs to be covered, which is the right doctor to go to. Important for the patients themselves, important for the family members to know what the condition is all about. But once you find a doctor, trust the doctor. It's as important for a doctor and a patient's relationship to be very close, to have that trust element, as it is for the family. If I, as a patient, trust my physician, I will trust the treatment, and then I will stick to it. And that's why when you find the right doctor, when you trust the doctor, stick to the treatment, stick to the doctor, and don't move away from that. You shouldn't think that it's an expensive medicine, so I should stop taking treatment. It's cancer is not something you can take 3 din ki dawai, 5 days ki antibiotics and stop. It's something you should continue taking treatment for. Take a second opinion, do that, but don't stop, is what I would say.
Okay. The trust between the doctor and the patient is very, very important because the confidence in the patient also helps them to just fight the disease better. Dr. Somashekhar, you said that, in our country, we don't have mammograms as a screening method. Many Western countries, like the US, started with annual mammograms, in the 1980s, and as a result, they have started catching breast cancer early, and survival rates are very high in the US. Now, given, Dr. Tiwari also spoke about the problems of access to healthcare, do you think annual mammogram screenings can actually work in our country? And are they really very effective? Because, there could be a chance that between two mammograms, you miss the cancer. You've done a mammogram and then the cancer comes and you're thinking that I'm all clear. Next day when you go, you see that it is not early stage cancer. So, what could be effective ways for screening in our country? Because this is a screenable cancer. If not mammogram, what are the options? And is there enough awareness about this amongst healthcare practitioners, amongst the general population?
Absolutely. Unfortunately, in India, we are a hub of infectious disease. If you see the national control programs, we would have a polio eradication, we would have a tuberculosis, we have infective disease. Because we have just come out of infective disease population, and national cancer control programs are not yet unveiled. If you see two most common cancers which have high dreaded mortality, death is cervical cancer and breast in India, but we don't have a national cancer screening program for breast. And second thing is, it's very important to understand Indian breast cancers are different than the Western world in following three ways. Number one, Indian breast cancers are a decade early. In Western population, it peaks at fifth decade, around 50 years, 45, 50, where mammography is very sensitive because the breasts become less dense, more fat. In India, large population of breast cancers are between 30 to 45. India is the house for youngest breast cancer woman. So below 40, the breast is very dense, mammogram doesn't help, number one. Number two, we have something called HER2 positive, which is an aggressive variety of breast cancer compared to Western population, which is not hormone sensitive. It is not only about the mammogram. To read and interpret mammogram, following problem, a lady has to come to a machine. It's a bulky machine. Even if you fit it into a bus and take to rural area, which we do, it cannot cover. The moment you say a rural, semi-urban lady has to come, compliance is extremely poor. Imagine a cervical cancer where the pap smear goes to her house, still compliance is so poor. So second, India ratio to radiographer who can report breast to number of population is very poor. First of all, doctor to normal population, very poor. Surgeon to population, even poor. Oncology cancer is even poor. So there is no. So a country like India, young woman, dense breast, not sensitive for picking of mammogram. Woman has to come to institution to do it, and radiographer not there to report. Mammogram is very poor way for us. So what has been advocated in India is at least a breast self-examination by woman herself and one clinical breast examination by a health worker. India is a robust system where we have this ASHA healthcare worker who would go home for maternity, health, and many other things. So a clinical breast examination, not necessarily by a trained cancer doctor, but at least a healthcare worker is the right way to do. Already we have a study which is done from Tata Cancer Hospital, Mumbai, in the whole Maharashtra, urban, semi-urban, followed over 10 years. At least one clinical breast examination once in 3 years and a breast self-examination, 50% saved the life of that woman. So for in India, this is already a published study done in India and Indian population. No mammogram, no ultrasound. Clinical examination by healthcare worker and self-examination itself saved 50% of deaths. So this is the way forward. Very large number, and it's in lakhs and lakhs of population, which is published in British Journal of Oncology, a top journal, and we already have this. So this needs to be integrated. Second issue, in India currently, cancer is not a notifiable disease. See, I'll give you one example. You saw COVID. The test is so expensive. RT-PCR, 3,000, 2,000, 4,000. Have you noticed how it was so efficiently managed? Without mobile number, no OTP, no OTP, no RT-PCR. The moment RT-PCR is there, healthcare profession, the government is intimated first. So it is a notifiable disease. So how India controlled it? Large population still controlled. So cancer as of today is not notifiable disease. We have a tip of iceberg problem known in cancer, which is 10 times more. Government of India should make cancer a notifiable disease. Forget treating, screening comes next. The moment it is notifiable, any cancer identified anywhere, notify them. At the end of a year, you'll be surprised looking at the magnitude of disease. Rural, urban, semi-urban. If we don't know the magnitude, we can't bring about a healthcare strategies. We can't allocate the funding. So I would, through the Association of Breast Surgeons, this is what we have done. Leave mammogram for in India, dense breast, young woman cannot come to a big hospital for mammogram, no radiographer to report. Even if you do mammogram, interval in between 2 mammograms, 6 months, you can develop cancer, not amenable for India. So clinical breast examination by healthcare worker, self-examination by a woman, and make cancer a notifiable disease. Then you will see a dramatic change we will notice.
Okay, I think the dramatic change that Dr. Somashekhar is talking about first will be in the numbers. So, Dr. Hema Divakar, now, he says what works better for Indian women because they are being detected in earlier stage and mammograms don't work so well. Is self-exam. Now, self-exam women may not be very good, but how can gynecologists come here and help? Like if I go to a gynecologist and say, I'm having discharge, you say she'll do a internal exam, write medicines, go home. Hey, she didn't look at my breast. She had that opportunity. She didn't do anything. So do you think that gynecologists can somehow help in this proactive early detection? And do you think if a mammogram is not sounding very feasible for everyone, at least women who are walking up to you could be, an ultrasound could be done for the breast just as a screening device, if not a mammogram?
Okay, again, Neha, this is Anisha. We are all focusing on Neha. And Anisha, this is again a key question in the Indian context or low middle income country context, because if we are talking about screening, it's a mass screening of how many ever girls and women we have, they need to be screened. Okay, for that, the two best things. So Dr. Somashekhar has said the triple thing we have to do. In that, he himself agreed. The two best things we can do is self-examination, because each one, your health in your hands. That's the campaign. And then, that's a hand that they have to use to do the self-check. That is, if you sensitize and generate a demand, that is doable. The second thing is that, yes, when the healthcare providers also at all levels of healthcare providers, because we can't just focus on niche specialists of OB/GYNs who have another 100 things to do. And even the pregnancy checkup, as Dr. Tiwari said, in the rural areas, 2 checkups also for them to have, it's like dismal. So, and then 200 patients in 3 hours, then they cannot be going on doing the breast check. It's like practically, it's not possible. So, yeah, so all levels of healthcare providers should know the basic minimum of how they have to do the breast check. Having said this, then out of 100, you pick up a subset of 2 or 4 patients. Then the next question, as somebody alluded to, where do they go next? That network has to be very properly established, because there has to be some connect. Otherwise, it will be just anxiety provoking, because nobody wants to miss. They overcall some situations. Thoda lump hai, baby cancer. Once you put that worm in her head, her life is gone, because she's so anxious that she just runs here and there to seek the answer that she wants to hear. So that again, we should not just as a ripple effect provoke the anxiety and leave. But as you know, Anisha, from your previous experiences, that I am a diehard optimist, and lot of innovative equipment are coming, and we are collaborating with an Israeli group, which for mass screening, it's a point of care. Even you're semi-skilled, you can just do a mass screening of the breast, and it will pick up something which comes. The technology is the key now. The marrying the healthcare to the technology is what we've been talking about several times in this forum as well. So if the specialist is sitting at the back end and he gets all these, and then he is able to chalk out which are the 4 people who need to travel all the way and come and seek help. So, the way forward is, yes, we have to sort ourselves out. This is a huge complex country with different levels of care. But each woman should be told about self-examination. There is no excuse that we can make towards that. The second thing is, yes, we can build the capacity of all the healthcare workers. That is also a low-hanging fruit. It's doable, but everybody should be convinced that this needs more attention than what it's already been given. The third thing is, if these simple equipment, innovative equipment come, then any camp setting, any home to home, any rural place, anywhere it should be feasible to do that simple thing which bypasses, the higher end tests, and we pick up and invest only on those who are actually needing this. With this, we may not be able to get at every single breast cancer for early detection, but at least more than the numbers which are now prevailing. 50% are lost in advanced stages. No, that will not happen. 90% we will be getting at a stage where we can do something good. Yes, still we have to acknowledge the limitation, 10%. That is an acceptable ratio for a country like ours. That is what we must be working towards, because being too pessimistic about it is also not going to help our women. Because first of all, the gender inequity is there. And even if she has and she's complaining to the family members, nobody is taking her to the right place to get the things done. That also, the social context also, we should imagine. Even if it's diagnosed, then they'll say, okay, go to the neighborhood and take this churn, and then, you'll get okay, rather than actually getting her to a proper care center for. So there are multiple issues beyond the technical, problems and the medical problems that we have to deal with. So in women's healthcare space, we would like to look at this comprehensively and holistically. And as I've told again, it's not Breast Cancer Awareness Day. It's not Breast Cancer Awareness Week. Now we have a whole month. That means what are we trying to do? We're going to sensitize, talk about it. So from there, somewhere it carries, the effects. So at least we have begun this, and to be aware that we need the awareness is a big step ahead.
Right. Dr. Somashekhar, I know you have to leave, so I'm going to ask you another question. And this is about the treatment of advanced cancer as opposed to early stage cancer. Is it always necessary to non-surgically treat early stage breast cancer, where you do chemo and you reduce the tumor size and maybe then do a surgery? While it's the opposite in advanced stage, where you do surgery first. So is there a big difference in the way advanced breast cancer is treated vis-a-vis early stage cancer?
Absolutely. We call them solid tumors. The cancers are broadly divided into liquid. That is what we call leukemia, blood cancer in layman term, and the solid, which presents as a lump, like the intestine, the breast cancer, the thyroid, or the cervix. In solid tumors, without surgical knife, there is no cure. Which means in breast cancer, without removing that lump from the source and checking the sentinel node, there is no cure. But if a lady comes in early cancer, following things should happen. The treatment is less intense. 99.9% she will retain the breast. It's a daycare procedure. Morning they get admitted, afternoon we do a surgery, evening they go home without tubes, with just a subcuticular suture. Next day, practically they can do their homework. And second thing is, if they come early, they may escape the other intense treatment like chemo, radiation, get away with just a anti-hormone tablet. So imagine if you come early, you retain your breast, less intense surgery, a small surgical procedure which shows no morbidity, and removing of the lymph node in the armpit would cause our hand to swell. We call lymphedema, which is a debilitating problem that is lost, and you may escape chemotherapy and other intense treatment, get away with surgery and anti-hormone tablet. So early breast cancer is highly curable, like 99%. In all cancer, we say 5 years if you are fine, but breast cancer is so good with modern advance, 10-year, 20-year survival we say now. So if somebody says, what is the other cancer? 5-year cure rate, but breast 10 to 20. So early cancer can be picked up only by screening, no sign symptoms, no lump. You will retain your breast. You may get away with just surgery and a anti-hormone tablet, which has hardly any side effect without advanced treatment. The moment you come in a advanced cancer, like a stage 3 and above, you need all three modalities. You would need a surgery, you would need a chemo, you would need a radiation, you would also need sometime immunotherapies, cost, duration, everything is lost, and you may also not be able to retain your breast. And sometimes what we see in India, where the lumps come in very big, you can't even do surgery to cure them. You have to give chemo first, shrink them, then surgery, then more chemo, then radiation. So you can imagine now the impact to the society, to the family, to the patient, burden on healthcare. It's too diverse thing, on either side.
Right. Yeah, I want to come to you because Dr. Hema spoke about very important things. You may get the system, you may get technology, you may get equipment to try and screen more women, but you also have to have a mindset that this woman is important. We have to get to the right place. So, did you know who to go to? Because your gynecologist told you to wait. Is it that streamlined? You are in a tier one city, you educated, well informed. Do you think we need to have streamlining in the systems of access to medicine, and this whole fear and stigma also has to be removed?
Yes, Anisha. When I was diagnosed with cancer, I've heard multiple times just now. Even I was told to go to a general physician, probably take a puri or a churan, or probably go to an Ayurvedic person or something or the other. Go to a homeopathic, take a homeopathic treatment or something or the other. Go visit this Baba. Go eat this antibiotic. But then of course, I would say that there are gaps in the system, because I delivered my baby in one of the most esteemed hospitals in Delhi NCR. I was surrounded by good doctors and good surgeons, and none of them told me that what it could be and who to go and visit. What I did was I like I said, I got my treatment done from Max Saket, and I was able to reach that doctor basis on my Google search. I took the matters in my own hand when the lump started growing, and still I was not able to there was nothing in the ultrasounds, nothing. Even I told you my first biopsy was negative. And I don't know, I'm truly amazed how it could have ever happened. That biopsy is generally a gold stamp report. My second biopsy was also negative. I was finally diagnosed in the third biopsy, and that too when I was first clinically diagnosed. I was physically told when a doctor, the chairman of the Max Group, he examined me physically. He told me it's a cancer. I told him no, my biopsy is negative. He told me go get it done again. He was convinced that it's a cancer, and 2 times my biopsy report came out to be negative. So I did not know who to go to, and I wasn't properly guided. There were multiple, I visited, I took not only 1, 2, 3, I took 10 opinions from different hospitals, good hospitals in Delhi NCR. And each of the surgeons, they did not wanted to come to a conclusion of my disease. They were just telling me, let's do the surgery. We'll find out during the surgery what it could be. I told them I don't want to go into an operation theater not knowing for what reason I am being operated for. They told me, okay, on one hand, I had a negative biopsy report. On the other hand, there was this chairman who was very much convinced that it is a cancer. He pushed me. He himself called me up because he knew that I'm too young. He pushed me to go to get the biopsy done again and again. I got it done the third time, and it came out to be positive. And the rest of the doctors, they were just telling me, let's get the surgery done. If it's a cancer, we'll remove it in the surgery. If it's not a cancer, you will be fine. We need to, as it is, remove the lump. So I told them, this is no way of getting a patient treated. I need to know why I am going into the operation theater first. And trust me, out of the 10 hospitals I visited, only this hospital where I got treated at Max, they were the only ones who were more keen on getting my disease diagnosed rather than getting me in the operation theater.
Okay.
So yes, I think there is a huge gap. I don't know for what reasons. Probably I don't want to blame COVID, because I think even if the COVID situation was there, still it's a doctor's role to get a disease diagnosed. And I had to push my doctors, I had to push my surgeons to examine me because I wanted to know why am I being treated and for what I'm being treated.
Okay, we get that now.
Anisha,
Neha.
I'll just chip in one small thing. It's
Mm.
very important to know breast cancer usually happens at fifth decade. If any lady like Neha has in young age, because anybody less than 40-45 is young, always they must also undergo a BRCA1, BRCA2, which is a genetic testing. Because a young lady less than 45 could harbor in India 15% of the time because of genetic. And the treatment then is totally different. The other breast is prone for cancer, ovaries are prone for cancer, their sisters, siblings can be protected by genetic counseling and treatment. So that's one of the issue which needs to be also kept in.
Yes,
so I would really agree with, I'm so sorry to come in between, I would really agree with the doctor because like I have told you earlier as well, my father was diagnosed with pancreatic cancer. I lost him 2 years back in 2018. However, I was told at that time to go for BRCA testing, which I didn't. So now I'm BRCA2 positive. I wanted to be aware my cancer is genetic. I had purposely, my breast could have been saved. The cancer lump got reduced. It actually vanished due to, I had neoadjuvant chemo. But I purposely went for bilateral mastectomy without any fear. I mean, because I knew that the chances of recurrence in the other breast are too high. So yes, BRCA test is one of the most important tests and I would recommend it.
Right. Nisha, you said that your mom has been taking cancer treatment for 11 years now. How do you see this time? At one point you feel that this is a gift. Every moment with your mother is a gift. On the other hand, for a caregiver, there are many trying moments because you sometimes, want to give up yourself. So, how do you see this, this cancer treatment as, how do you see it? I mean, is it just any chronic disease like a diabetes that you're treating, and is it more debilitating? What is the mental load it takes on the patient and the caregiver?
See, as I see it, you should rather consider it as just any other disease and not, okay, yes, it is something much more larger than, any other, let's say a fever or a cough or anything. No, it is not on that scale. But when you bring down its intensity, when you sort of start believing that, yes, it is treatable and it is something that we can take care of, I think it becomes a little easier to manage that path because you somewhere gain confidence that, yes, there are solutions for everything. Solutions may not be easy. They are never easy when you're dealing with an advanced stage cancer, especially, someone close to you. But when you take one day at a time and you sort of start doing your own homework and your own research, you look around, you talk to multiple doctors, you get your own details out there, and you realize that the path is manageable. Yes, the moments are difficult. It's never going to be easy. One is managing the patient, looking at them going through all of these things day in, day out. Secondly, managing the multiple number of people who will come and give you advice. Even they have absolutely no clue of what is happening in your life, how you are dealing with things, how the patient is dealing with, but no, they have an opinion on everything. They'll come and advise you. You have to deal with all of that as well. But what helps is when you have your own scientific background, research done, when you have your own homework, which is more on a practical scale, and you know what steps you have to take further, what is the medicine management that you have to go for, that if this particular medicine is not functioning, if these are the side reactions happening, or let's say you don't see any reactions happening which are originally scheduled in a medication, you do have to keep an eye out for these smaller things. You cannot ignore any symptoms. You cannot let go of things. I'll give you as an example. There was a certain medication. My mother was on endocrine therapy for about 3.5 years. And one of the key side effects mentioned was high insulin. The blood sugar would be very high, in the range of 300 and 400. This was one of the main side effects mentioned of one of the medications. Now, suddenly, after a certain period, we noticed that the blood sugar was coming in a very normal range, despite all the other medications, everything. We did feel that something is wrong here. Now, when you keep your eyes and ears open up for these kind of things, we got her tested again, and we realized that the disease had progressed a bit. The medication had shown a certain bit of resistance. So when you sort of understand that, yes, these are the things that you need to take care of, you do your own research, keep an eye out, it gives you a quicker way to respond to further treatment. So immediately we changed the treatment to something else, some other medication which she would respond to better. And I think this, like I said, as a caregiver, you have to be on your toes. You have to keep an eye out for even the minutest of details, because the patient is not going to be in a condition to do that.
Right. Nisha, have you thought about doing the genetic testing? Because like Dr. Somashekhar was talking about, like Neha has also spoken about, the BRCA1 and the BRCA2 test. Have you considered, since your mom has breast cancer, have you considered undergoing genetic counseling?
Yes. See, my mother took a BRCA test last year for one of the medication treatments that we were scheduled to go for, and she came as BRCA negative. So the doctor mentioned that, since she's a BRCA negative, you don't need to undergo that test.
Okay.
At this point.
That's great. That's great to hear. Dr. Tiwari, we've seen a lot of advances in cancer treatment. My mommy had breast cancer 30 years ago. At that point of time, the medicines were tough. Side effects were horrendous. She had lost her hair, which I think happens now. She had come half her size. She wouldn't eat anything. She was nauseous all the time. There have been advances in cancer treatment, and I'm sure for breast cancer treatment, now we have specific targeted treatment as well. How accessible are these therapies for the larger majority of breast cancer patients in our country?
Yeah, since last decades, there is a lot of changes in the treatment of cancers, in all cancer. And if you talk about the breast cancer particularly, because the incidence of breast cancer is highest of all cancer. If you talk about both male and female, it is the second highest the cancer. So definitely the research is more and more going on in the breast cancer. And if you see in last 10 years, now we are moving more towards the personalized therapy. Now we are using the term the personalized therapy for the every cancer. Similarly, for the breast cancer also, we are using personalized therapy. Like if the tumor is showing some particular genetic characters, then the treatment should be directed accordingly to that. Initially, we have only chemotherapy. That the chemotherapy is a generalized treatment. Chemotherapy doesn't know which is the cancer cells and which is the normal cells. So it damages both cells equally. Therefore, the patients got side effects, okay, apart from the eradication of cancer. But now we are using the targeted therapy, immunotherapy, depend upon the tumor genetic characters. So now we are doing the genetic profiling of all the cancers, and BRCA is one of them. Since last 5 years, because now if the patient is BRCA positive, we have a lot of options for the BRCA positive patients. Therefore, we are doing BRCA test and so many other tests for HER2 positive patients. In hormonal therapy, if you say, we have a lot of options of hormonal therapy. If the patient is resistant to one hormonal therapy, then we can shift to another hormonal therapy, then third line of hormonal therapy, fourth line of hormonal therapy. And the beauty of these all therapies that the side effect profile of these therapies are very less. I mean, they're very well tolerable. In many cases, if you suppose if you are going on the chemotherapy, every time you have to go for the blood check and all the other different type tests. But if you are on the targeted therapy, there is very less requirement of intensive investigations required, like multiple blood tests, repeated ECG or cardiac examination, so many tests. So there is a lot of advancement. The immunotherapy is coming up, anti-BRCA therapy is coming up, a lot of other hormonal therapy is coming up, and these all are harmless therapy. As far as the cost is concerned, some of drugs are still really costly, but many drugs, if you see in last 2.5 years, the cost of many drugs, the drugs which are in 2-3 years before 50,000, 60,000 cost, now they are you can purchase it in 10,000 or 12,000 rupees. So the cost is going down. Many drugs which are now in 50,000, 60,000 range, I hope in coming years they are also going to in 10,000, 12,000 rupees. And if you see many of these treatments for those person who are not affording, because we are treating patient under Ayushman Bharat Yojana also. So those drugs who are initially 50,000, 60,000 rupees, now we are giving these type of therapy in Ayushman patients for those patients who are coming from the rural backgrounds. They are totally illiterate. They cannot afford even 500 rupees therapy. They are taking such type of treatments. So there are a lot of advancement is have already happened, and a lot of advancement is going on. If you will see in coming 3-4 years, might be the chemotherapy will be not be used in cancer patients, because the targeted therapy in the form of oral or in the form of injectable immunotherapy, they are coming with very good result, and it's coming with the affordable price also.
That's very heartening to know that advanced treatments are being given to patients under the Ayushman Bharat scheme as well. Rubina, what advances are being done furthermore from here on? Because like Dr. Tiwari told us, you got targeted treatment, you got hormone specific treatment, you got immunotherapy coming in. So when it comes to advancements in cancer treatment for breast cancer, what is the latest, or what is the next to look forward to?
Advanced treatment for breast cancer, where this really starts from is our understanding of breast cancer. If I go back to 14 years back when my mom was first diagnosed with breast cancer, it was just one word, which is breast cancer. In this last decade and a half, we've come a long way, and we realized that breast cancer is not a single disease, but it's every woman could have a different type of breast cancer. Some are sensitive to hormones, some are not. Some are sensitive to some kinds of drugs, some are sensitive to some certain kind of genetic mutations that are in the body. And that's where the personalization of treatment really begins. So super important for the family, for the patient to understand that their own case might not be the same as the case of a neighbor next door, or kisi ke chacha ki mami ki someone, another far off relative. And the doctors are today working to make sure that they can improve the survival of every patient. So the treatment you are being advised as a patient might not be the same as the treatment somebody else was advised. That's super important for us to remember. In terms of the advancements, like Dr. Srikant Tiwari also said, we've moved from chemotherapy being the foundation of cancer treatment to more and more targeted therapies. First, we started off with targeted therapies, just working on hormones in the body. Then we moved on to figuring out genetically why is one person's cancer different from another, and now we are targeting that particular genetic mutation. Moving forward, we're also trying, there are actually a lot of genetic mutations. BRCA is one of them. And BRCA is something that through genetic counseling, genetic testing, we can identify. But many patients, when they first undergo a biopsy and a full battery of tests is done, the doctors do that. The doctors do 3, 4, 5 tests to understand how her cancer is unique from others and how they can best treat her. So from that mutation-based testing, we're also moving to an era where we can look at more how we can target her own immunity. We all have a strong immunity. Can we use her own immune system to kill the cancer inside her? That's one way of looking at it. I also look at a different direction, going from when you think of cancer and you think of treatments. We've always looked at going to the hospital every second, third week and taking injections and losing your hair and being nauseous and so many other side effects, to the point where the woman isolates herself from society. She doesn't want to be seen out of the house. She detests looking at herself in the mirror. For me, advancement is also where the woman accepts it as a part of her, but is comfortable remaining in the same society. So from healthcare providers' perspectives, one is a kind of treatment. We're also looking at advancements in how can that injection be converted into a pill. Can a patient be sitting at home, pop a pill and say, I'm getting treated for cancer?
Oral treatment.
Oral treatments. Can a patient look the same before she had cancer versus after she had cancer? Can she have the same luxurious hair? Can she have the same beautiful skin? Can she look the same? Can she feel as confident? I think if we can deliver that, that itself is a huge advancement. And we are working towards that as well. And we're just keeping our fingers crossed. We're also working, like Dr. Tiwari said, this Ayushman Bharat is a brilliant scheme that can really help the population. We also work with, there are state governments, there are other providers, there are insurance companies with whom we are working to see how treatment can be made more affordable and can reach out to more and more patients. across the country and across all segments.
All right. So there are pathways being forged by insurance, by government schemes, and of course, the line of treatment so that it becomes more accessible and easier for cancer patients. Nisha, Rubina spoke about, one thing being advancements in cancer treatment, the other being the society be more accepting of cancer patients as well. Why should they be made to feel they have a dreaded disease or they cannot, be part of the normal social circle that they used to be because they have cancer? Is it true? Are cancer patients sometimes discriminated against?
Hello?
Yeah, Nisha, go ahead.
Yeah. No, I don't think so. Okay, yes. I think it comes with your own mindset, of the patient and the people surrounding the patient. So when you treat them as normal, when you treat them as, yes, this is something that you'll get over with, give them the confidence to face it. Yes, breast cancer, sometimes ladies do lose hair. They do have they lose a breast, they lose hair, their entire morale goes down, at that point. They do find it difficult to go out in society and everything. But if you accept them that way, you don't make them feel any lower. And the people surrounding them, they give them the confidence that, yeah, this is something normal. You will get your hair back in another 6 months, a year. I remember our doctors telling us that your hair will come out even more luxurious. You don't have to worry about it. This is a temporary phase. The doctors were kind enough. They pushed us. And somewhere, my mother, like I said, the patient has to be of a very strong mindset. And combined with both of this, I think they come out very well. If the patient has a very weak will and a weak mindset, and when you have society telling them things about, you lose hair and, this is how we will look and how will it look otherwise, they do tend to feel a little much lower in terms of confidence. But the right support system matters. So if you have people who are going to come and cry to you, when they see the patient, you keep those people away as a caregiver. You make sure that they don't see the patient at any point. Or if they are supposed to meet, you tell them in advance that this is what you're not supposed to talk in front of them. Or if you do want to talk, give them the points, but keep the negativity away from the patient. Because at that point, what you need to do is build them up, not, drag them down even lower.
Yes, definitely. Dr. Tiwari, when, since you are you're in Bhopal and you must be seeing patients from all over Madhya Pradesh, when patients come to an advanced disease, how do they approach your diagnosis? Are they saddened? Are they fatalistic? Are they motivated to continue with the treatment? Given that now you're saying that these even advanced treatments are covered in Ayushman Bharat scheme, and there is assistance. There are, I think, patient programs also run with pharmaceutical companies. So when there is a diagnosis of advanced breast cancer, how do patients deal with it?
Sorry, can you repeat? The voice was I have not heard actually. Was
Dr. Tiwari, my question is that when you give the diagnosis of advanced breast cancer to patients who come to you, how do they take it? Because now, we are seeing advanced treatments. You also said that in Ayushman Bharat scheme, some of these advanced treatments are available. Plus, pharmaceutical companies also have patient programs for, subsidized treatment for a few who cannot afford it. So, how do they take this diagnosis that you have advanced breast cancer that may not be curable?
Okay, so look, whenever the patient reaches to our OPD, look, we are the oncology department is the tertiary department. So usually the patient doesn't even they don't want to come. They don't come, and they don't. No one want to come in the cancer hospital. Okay, so say they go through the different channels from their primary physician to surgeon and the different through, and then they reach us. And whenever they come in advanced state, then look, it's sometimes very difficult for us, especially for those females, or sometimes look, the breast cancer although it's not very prevalent, but we have seen the number of cases in male breast cancer also. So if we say them, look, you are having advanced breast cancer and we can control it only, we cannot cure it. So sometimes the patients are in the denial mode. They don't accept it, that I am having such type of disease which cannot be cured. And even in early stage also, if you see, I don't know why, due to lack of awareness, the patients are so scared of their disease. We sometimes used to say that, look, if you are having diabetes, the diabetes is incurable disease, you have to take lifelong treatment, and you are not scared of that. And the cancer, your cancer is curable, and still you are so much scared of the treatment, despite I am telling that the cancer is curable. Okay. It is curable. As far as the advanced cancer is concerned, definitely we have to do a lot of counseling in the initial parts till the patient's motivated. It's not only the motivation of patients only, it's the motivation of attendants also, the family members,
and the family also.
Motivate.
Yes, because the family feels that they have to bear a huge expense for somebody who may not live long enough, and in the rural areas, healthcare costs are very high. So then how do they take this diagnosis?
So
you show them the way on how they can afford it, how it is possible for them to treat the ailing member well and get them treated, and not leave them to their ends. Ab kya ho sakta hai?
Definitely. Look, my hospital is not the corporate hospital, so the cost is not a big issue for those patients who are reaching in my hospital. So we are doing on almost no loss, no profit basis. At least my hospital is doing, and the many patients who are enrolled in different programs, including the Ayushman Bharat Yojana. So first of all, we have to counsel the patients, attendants. It's not only the financial parts. Many times we have encountered with many patients who said that, Doctor Sahab, मुझे तो घर से कोई लाने वाला ही नहीं. How can I will come to your OPD? Even if I say, okay, your all the treatment will be free under Ayushman Bharat or any XYZ government scheme, but no one is there to take care of the patients. Suppose if I will give chemotherapy to these patients, then I know who will take care of her at home if patients will develop some side effects. Suppose if she will have repeated vomiting and no one care of her, then she will be dehydrated before reaching us again to manage the side effects. So a lot of things we have to discuss with the patients along with the family member. Apart from the financial counseling, we have to discuss about the all other the part also, like the patient has to come, someone should be there who can take care of the patient, someone should be there if required of blood transfusion or all other things, there should be a person who can donate the blood, and then we discuss the financial counseling. Okay. Definitely, whenever we say about the prognosis, whether how much should be the survival, we are little much guarded ourselves for the patients, but definitely we explain everything to the nearby the relatives.
Okay, you are very transparent in describing the disease and its treatment to the caregivers. Now we're coming towards the close of the show, and I want to take some closing comments. Neha, let's start with you. You're a fighter. You're a warrior, a cancer warrior. Now, in hindsight, we're always smarter. What would have done better if you could have turned the clock back? And what would you like to say to people who believe कि मुझे नहीं हो सकता? I'm too young. मेरी family में नहीं है. मैं तो सब चीज ठीक करती हूँ. मैं तो smoke नहीं करती. I don't drink. मुझे तो नहीं हो सकता. What would you like to say?
Anisha, I didn't get your first question. What was the first question?
My first question is that if you had the power to turn the clock back, what would you do differently in your cancer diagnosis treatment? And what would you like to say to people who believe that, cancer happens to someone who is very reckless, who is not healthy, and it cannot happen to them?
First of all, if I really had that time-ticking clock and I could go back in time, I would have been more proactive towards my health. I would have taken my health more seriously. And trust me, I should have faced my fear of cancer head-on. I mean, I delayed my diagnosis by 4 to 5 months. I should have pushed harder my doctors, my surgeons. I should have taken more proactive steps. For the second question of yours, I would tell everyone that, I have been gymming, exercising, yoga, meditation. I've been doing every single thing from last 10, 12 years. And the first thing that came to my mind was, mujhe nahi ho sakta, why me? But then I think anything could happen. And, whatever happens in life, you should face it head on. And only if you are able to face it, whatever the circumstances are there in front of you, you will overcome it. When you face, when you think that there is something in your body which is giving you a signal, instead of thinking, okay, baad mein dekh lenge, family first, or instead, we as women, we don't prioritize our health. We should do that more often, I think. And we should, face everything head on. We should not put it in the, under the carpet, or just let
On
it
the back
go, or
burner.
anything like that. Yeah, we should just face it head on. There is nothing like mujhe nahi ho sakta. I think it could happen to anyone. Cancer is not a death sentence. It's a disease. It's like any other disease, I would say, if diagnosed at a proper time. We really have to be very, very, very proactive and conscious of our own health. I would say this.
Right. Nisha, what would you want to say to, in conclusion, to everyone who watches and perhaps judges people who have cancer? ये वो तो तंबाकू खाती हैं, वो तो स्मोक करती है, ये तो होना ही था, कैंसर है, अब क्या होगा, अब यहाँ मतलब इनसे नहीं मिलना चाहिए, or anything, or oh, cancer is a death sentence, it's just a matter of time. What would you like to say? Because the kind of advancements we've had for cancer, people are living longer. Cancer is being managed like a chronic disease. What would you like to have changed, if anything, in the care of your mother over the last 11 years?
See, I'll be very honest with you. I've tried telling this to a lot of people that, listen, it is curable. Okay, this was way earlier. And I've literally fought with a lot of people over, like, you don't know what the situation is. And why are you even giving me an opinion on this? You don't know how the medical science has progressed, how the developments are happening. So at some point, people are not going to listen. They are going to judge. The society is a very narrow-minded situation, depending on what it is. They have half-baked knowledge about things. They read things from here and there. They pick up things, what they hear. They are never going to understand the core situation that you're in, because as someone rightly said, the cancers are very personalized. Every person has a different situation to handle. It's not like it's a generic thing that, someone else had something and it's going to be the same with us. So people follow their own perceptions. They are not going to understand. So the best is you make sure that the patient is willing to handle all of this. And simultaneously, as caregivers, like I said, you have to make sure that negativity doesn't reach the patient. And you also have to make sure that the patient understands that, yes, these people are being kept away for a certain reason, because they don't understand the intricacies of what you're going through, of what the medical science development is. Even at this point, like I said, we are trying to work on immunotherapy for my mother at this point. We are exploring the genetic testing and everything. All the samples have been set out. We have chosen not to tell a few people about it, or people out there about all the developments, because we know that they are not going to understand. At this point, their perceptions are very limited. They are not in the capacity to do their own research. They don't understand how it is for us. So best is just keep things low. Don't even try and attempt it, because the more you attempt it, the more it's going to come back to you, and you are going to go in a depressive state, which you really don't need at this point, dealing with things. This is what I would say is the best way to, at least for us, seeing
as caregivers. Be able to decide, how you care for the patient, and also put your foot down on what you don't want the patient to go through.
Exactly. Yeah.
Right. Rubina, there's a lot of hope in new age medicine, because the way technology is advancing, AI, analytics, like Dr. Hema Divakar was saying, technology is coming to the rescue. You'll have a questionnaire. You fill in the question on the app. Data will analyze who is perhaps more at risk. They'll be called for screening, etc. So there's lots that can happen. So for patients who are scared, are fearful, what would you like to tell them? Because in India, one of the best ways and to get advanced cancer treatment is get into clinical trials. In the US, this is a very popular way of getting the best treatment. Clinical trial in India, we are not guinea pigs. Hum kyun guinea pig bane? So how to get the right attitude about the way medicine is advancing, and the hope that it has for cancer patients in the future?
Thank you so much, Anisha. This is actually a brilliant point because my mother, the first time she got treatment, she was lucky to be enrolled in a clinical trial. And all my relatives had exactly the same reaction. You know, your mother's not a guinea pig. Why should she be put into a trial? Kya cheez hoti hai? But trust me, I think she is alive today, she's healthy today because that first treatment, the clinical trial, gave her the best in class treatment. So that made things very, very easy for all of us. But what's very important is a point where you said the fear. We have to trust our doctor. We have to understand one thing. Our doctor is our doctor for a reason. Google and the next door auntie is not a doctor. And when our doctor tells us that this is the right treatment for you, or the right treatment for you is going to come to you through a clinical trial, give that a chance. Trust your doctor. Clinical trials, if you talk only about clinical trials, I would say they take care of the patient in every way. The patient is explained what a trial actually is, what kind of treatment to expect, what kind of care around the treatment. So, if you have a side effect, who do you reach out to? Who do you inform? How will the company or the doctors, how will your treating team help you manage that side effect? How are you going to be handheld throughout the course of your treatment? That care, the monitoring that you receive while you're on a clinical trial is unparalleled. And I would not say that the clinical trial treatment in India is any different from that in any other country. That treatment is still the best in class. What matters is how scared we are. A good point is that the Indian authorities, Indian governments are becoming more and more accepting, more and more open of allowing pharmaceutical companies to do clinical trials in India. Hence, pharmaceutical companies are also investing more in doing clinical trials. So where we used to have drugs approved in India with no patients in the trial, today there are drugs coming in where we ensure that there are 20, 30, 50, 100, whatever, but there are patients from India in the trials. So we have very core Indian evidence that goes with it. But with all of that being said, my message would be, it's right to be, the patient and the family are right in being scared, but please trust the doctor. Do your research, but don't trust Google so much that Google will decide this is the right treatment for you. That Google can't do. Your auntie can't do. Your doctor can do.
So trusting the doctor is very important. So I'll leave the last word to Dr. Tiwari for the show. Dr. Tiwari, how would you like to give hope and motivation to patients who may have been diagnosed at an advanced stage about what lies ahead because of advancement of treatments, the outcomes they can look forward to? Dr. Tiwari, you're muted. Would request you to please unmute yourself.
Okay. So whenever we first encountered with the patients, we start with the things that the first of all they should accept the disease. That look, for whatever reason that has happened. Look at many types patients start with the doctor sahab abhi कुछ समय पहले तक तो मैं बिल्कुल ठीक थी, how it can happen suddenly, मैंने कभी कुछ नहीं लिया, how it can happen suddenly. The first things we just try to motivate that they should accept the disease, that has happened, whatever will the reasons. Many times in the cancer is not a communicable disease कि हम कहें कि मच्छर काटने से हो गया. Many times we cannot find out the reason of the cancer. So first realize them that she is suffering from the cancer. And the second things, if the cancer is in the curable stage, then we says that okay, it is in the curable stage, you have to go through certain form of therapy, and these are very short term treatment. After these treatments, you will be all right, your hair will be like as before, your skin will be like as before, your appearance will be like as before. Second thing, if the disease is incurable, then still we used to say that look, there are a lot of advancements. We sometimes used to show them the data on our laptops or computers that look, these are the data, how you can take the treatment for longer duration and you can survive for the longer period of times. So look, this is the department. Oncology is the department where a lot of counseling is required to the patients, because the patients are so much scared. This is the only department where the patients are so much scared of the disease. Look, if the patient have heart disease, heart attack, they are not scared of the heart attack. Once the patients recovered, then everything is okay. But once the cancer is happened, then the family members are so much scared. And the second thing, the reason for so much scared, why they are so much scared, the treatment is long. The treatment cannot be short duration, 5 days or 10 days. The treatment is long, so they have to come up with this. So we used to counsel them again and again, every point of time. We give them hope. In fact, every time, even if we know that the end is nearby, but still we give them the hope, at least to the patients. Family members know the exact things, but the patient, we always give them the hope. So by sitting in OPD, we sell the hope.
Thank you, Dr. Tiwari. Thank you, Rubina, Nisha, Neha, and Dr. Divakar and Dr. Somashekhar had to leave earlier. Thank you all for joining us and talking to us about breast cancer and advanced treatment of advanced breast cancer. You know, we all are trying to start this conversation so that we talk to each other, make each other aware. More women do self-exams so that they take the health in their own hands. And we would like to wrap up the show here. I want to thank all of you for joining us. But we'll be back once again in another episode of the month-long e-campaign on breast cancer awareness. Do join us again. We'll be back soon. Bye-bye.
Thank you.